All right, let me back out of this one. So next, I'd like to introduce you to Dr. Doug DiOrio. And let me put you up here. I got you.
Thank you for having me. We were asked to talk about how microcirculation affects our practice, a little bit about who we are and what we do. And instead of going over my whole practice, as you can see, I've gone through lots of different trainings and continue wanting to learn all kinds of alternative methods of taking care of patients. I think my practice has really had three changing moments in it. First, when I was in my sports medicine fellowship, I was trained in acupuncture, manipulation, and myofascial release. So when I came out as a doctor, I was already focused on wellness, health, and from a musculoskeletal standpoint in treating injuries. The second was about 13 years ago, and I thought I was a pretty healthy guy. Did marathons, half Ironman triathlons, did a bunch of stuff, and then all of a sudden I got diagnosed with thyroid cancer. So I had thyroidectomy, radiation, treatment, and they said, hey, we didn't get it all. So went back, had a radical neck dissection, took everything from my ear down to my aorta on the left, and my thyroglobulin 4 months later was still positive. So I embarked on looking at every single alternative treatment out there, focusing on nutrition, exercise, stress reduction, health, wellness, aromatherapy, you name it. Went through it, worked, changed my lifestyle, and by the grace of God, I'm cancer-free. And I think the third practice changer in my life has been Beamer, and I thank Judd here, my good friend, who introduced it to me. And it's been such a great tool to add to my repertoire of tools to kind of help take care of patients. When you're the acupuncturist, as Josh can attest to, and you do functional medicine and alternative medicine, you have all kinds of tough problems come to you. So I get the tough nerve problems, I get the tough muscle problems, I get the tough joint problems, and I get the idiopathic problems, which idiopathic means we don't know why. I say it's because doctors are still idiots on some things, we don't know. But these problems come and try all kinds of approaches to get people better. And it's just been a great adjunct as I've been able to treat people with Beamer, and they've had great success at feeling better. So I look at it as a wellness tool, and not everybody in America agrees with thinking about health and wellness and just feeling good. But boy, if you can give people more energy, better sleep, thinking better, and get rid of their discomfort, what a wonderful thing. We can all walk around feeling better. But the second part, and probably why I'm here as a sports medicine physician, I've been lucky enough to take care of Division III colleges, Division I colleges, and even professional athletes, is the performance component of it. I thought, hey, I'd put up the formula for VO2 max, and in endurance we always talk about, how do we improve endurance. But I'll just say this, the rate limiting step for any endurance athlete is transfer of oxygen at the smallest blood vessel to their tissue. And if we can open up those small blood vessels, you're going to increase their circulation to their muscles, and they're going to get better, and they'll be able to perform better. And secondly is recovery. We see baseball playoffs are going on now, and these pitchers have to recover, turn around, pitch again in 3 days. And if you think about delayed onset muscle soreness, all that muscle we get sore after we do some new activity that's 24 hours later, that's all about toxins and breakdown products, lactic acid we call it, in the muscles. And if we can get that out of the muscles, we can reduce soreness and we can get back to working out better. Me personally, I've seen great success with this, with my patients and with myself. I feel like I'm working out harder, and like I'm 30, I'm running times that are a lot faster and strength a lot better. So I just have had great personal benefits from the Beamer, as well as benefits with my patients. And then lastly is how I use it in my practice. I am actually an employed physician of a hospital system that does not allow me to use it in my practice. So I have got permission to do it as an outside source business. And so I introduce it and get people's emails, phone numbers. I email them stuff and then give them my cell phone, and we start talking about it, and I add it as an adjunct tool outside of actually in my office. Thank you.
Yep, very good. All right, Dr. DiOrio, both of you and I have actually very similar interests in medicine, including your heavy focus on physical medicine. How have you seen Beamer support your work in physical medicine, either as an adjunct or standalone, for yourself or for patients?
The increased blood flow that we see, if you talk about any chronic injury, muscle soreness, muscle discomfort, the areas that we break down in sports medicine are due to blood flow. And why we break down an Achilles tendon where it is versus higher up in the calf is all about blood flow. So I approach many patients with myofascial release techniques to get tight spots out, along with acupuncture, which also increases blood flow, as you know. And so this is something that we've been able to add in training rooms and outside of practice, where people can now take it home and do it over and over again. So I kind of say this is like you being able to do acupuncture to yourself every day.
Wonderful. In addition to that, for instance, with osteopathic manipulation or with acupuncture, do you utilize Beamer before, during, after? What's your thoughts on that?
I don't think it would matter before, during, or after for it. I mean, especially if you're talking about using the body, you're going to get 12, 15 hours of increased blood flow. As we talked about, unfortunately, I don't have it in my practice, so I can say, oh, I'm going to use this before or after. What I have found actually is a lot of people who are more focused on wellness, who come to me for maintenance manipulation or maintenance acupuncture, they're coming to me less because they're using their Beamer at home and they don't have to come to me.
Wonderful, thank you. Dr. DiOrio, so there's been scientific reports in the literature that in addition to impaired cerebral vascular reactivity, that vasomotion is negatively affected or decreased with traumatic brain injury. And I know you're in sports, I know you working with some fairly high sports athletes. Do you see a potential of using Beamer as a modality that may support the resuscitation of vasomotor function or neurovascular type of integration for traumatic brain injury or trauma?
Yes, actually I was talking with Michael, and we went over some different protocols that have been used out there for treatment of brain injury. And so I've had it and I've used it on 2 or 3 people. It's so hard to put a time frame on it, because when someone has a brain injury in sports, the recovery is variable, and so I can't say enough to say, well, oh gosh, well, this definitely cleared. But I did have one person who was out for a good month or so, and then after we treated her, she was able to recover pretty quickly after that, whether that was time or not. But I definitely see, when you talk about injuries in general, we know inflammation decreases blood flow, we know swelling decreases blood flow, and we know lots of factors that come with injuries decrease blood flow, and to heal anything, you have to get the blood flow back there, to get the waste products out, the breakdown products out, and get the healing take place. So you need to get the nutrients there, and blood flow is the way to do it.
Beautiful. Yeah, I agree 100%. Ladies and gentlemen,